today we're talking to Dr. Nelu Simonsz, who is a pediatric specialist who has transitioned to consultant a couple of years ago, and we're going to talk about that transition from registrar to consultant and all that goes with it. Nelu has a large social media following, and she uses her platform to share useful kids' health tips. And recently, she did a presentation about this registrar to consultant transition. Got a huge amount of interest in what she had to say. So here's an opportunity to share it to you, the listener, to a wider audience. So welcome, Nelu. It's fantastic to have you here.
Hi, Sam. Thank you for having me on the Well Doctor series. I'm really happy to be here and to be spreading this information.
Thrilled you're here because it's an important conversation to have. This one, medicine is quite unique in that it is a pathway where, all roads lead to Rome. Essentially everyone becomes a consultant. And unlike a lot of jobs where not everyone goes into management and leadership because that may not be what they want to do or feel that that's their skill set, in medicine we all become managers, we all become leaders. And I think the thing, something that we talk about in business is this thing called the Peter Principle, where people get promoted to their level of incompetence. And so what we want to avoid, I think, with doctors is, being promoted to a level of incompetence when it comes to, management, when it comes to leadership. And so that means we need to be prepared, doesn't it? It means we need to, understand what we're going to be facing and then prepare ourselves for it.
Absolutely. And I think, we all go through training, we learn the clinical aspects, we learn the patient aspects, but you don't really get to learn the leadership, management, administration side of being a consultant. And so much of being a consultant is that. I think it's really underrepresented in training programs. Which is why I'm really passionate about spreading this information.
It's interesting, over the years I've had a lot of conversations with doctors, and there's some themes that come up consistently. Becoming a doctor is a challenging time. Getting onto training programs is another really challenging time. And the third one is transitioning to consultant. Like that's the next big sort of challenge that we face. And it's an area where, as you say, if we prepare, if we have some conversations, if we actively learn about it, we can really be in a position to, have a really positive impact. We know this generation of doctors needs to do things a bit differently from the last generation. So this is our chance to actually step in and be great leaders, to be great managers and empower this, this generation of younger doctors.
And it all comes down to patient safety, right? If your team's happy and feeling well supported, then your patients are being better looked after. So there's a massive flow-on effect.
That's a great point because that's ultimately what it's all about. So today we're going to cover a few areas. We've got a bit to navigate. It's a pretty big topic. We're going to talk about what you need to do to prepare. What are the two things you need to think about? Nelu's going to share the good, the bad, and the ugly about this transition. We're going to have a conversation about public and private because that's private is something that is completely new, in terms of working in it for many, many doctors. We're going to talk about the mindset and the identity side of it because, that top 2 inches is a hugely important part of this transition. And we're going to talk specifically about, Nelu, what leadership means for you. So let's get into it. Let's start with, what do you need to do to prepare? What are the key areas that you need to think about, as you are becoming a specialist to be ready?
Yeah, so if we talk about the practical things first, and I think again this is stuff that we just probably don't speak about enough as a cohort in general. So one of the things I'd say is think practically about how you're going to navigate your finances, because I think that's really important. Doctors are notoriously terrible at thinking about money, finances, investments, whatnot. One of the best bits of advice I got was to create my own bank account for all of my consultant work. It just makes it much easier in terms of BAS statements and accounts and whatnot, especially if you're doing private, to have a separate bank account that you can track. Which sounds really simple and trivial, but it's much harder to backtrack on something like that once you get started. So that was something that I would prioritize getting done before I even started all of my work. And get a good accountant. Unless you're really keen on spreadsheets and numbers and putting together GST statements and things, I mean, a lot of us just don't have the time or the energy to do that. And if you do, fantastic. But if that's someone like yourself, I'd invest in a good accountant who just sorts that all out for you. Because again, the mental load of life in general can become a lot, and there are things that you can't let slip, and money is one of them. Particularly if you're working privately, it's a bit easier if you're working primarily in public because you get your pay slips and your your end of year tax statements, but the reality is most of us do a bit of private. So I think it's really important to think about the financial aspect even before you start making a cent.
And sorry, and a great point you make there, which is this wee sidestep that we hadn't discussed before this, but it's, getting a good accountant, but, valuing your time. When we talk about finances, we're also talking about the time value of you as a person. And, as a doctor, you're much better to pay people to do the things you don't want to do, aren't you? And they're going to be infinitely better at it as well. So, building that team around you, which includes a good accountant, is such an important part to start off as you mean to continue, I imagine.
We're very, what's the word? Very advantaged in that we often earn enough to be able to outsource. We're very lucky in that way. And so I think it's about making your life easier, particularly if you're a parent or you've got codependents. I would much rather spend my time with my children than be sitting and trying to do my taxes. So I think you just have to think about your priorities. Um, and the other extension of that is thinking about, especially if you've got dependents, income protection, wills, all that sort of nitty gritty, annoying stuff that we don't really want to think about. But once you're on a consultant salary, if for some reason you can't work, you just need to be thinking about that for your family. We're in a single income household, for example, so we really need to be thinking about that. So that's kind of the practical nitty gritty that I think everyone needs to have set up, and just having all your ducks in a row, having all your documentation ready to go, your APRA, um, provider numbers, prescriber numbers, just having all of that set up ready to go so that if a job comes up, you can just apply for it and you're not chasing your tail. So, so just practical tidbits like that I found super helpful. Um, and then I guess the other thing is looking for jobs. I have so many people message me saying, I'm finishing training soon. How do you find a job? And I don't know what the climate is like elsewhere outside of Victoria, but it's pretty hard to get a public post, which is what most people want as part of their portfolio as a consultant for many reasons, which we'll chat about in the good, the bad, and the ugly. The reality is there's often a lot of private work, so most people would end up doing a mix of both. How do you find the perfect job? There's no answer. I think a lot of it is right place, right time. So trying to be a bit strategic towards the end of your training, thinking about where you want to end up, maybe if you can focus some of your last year or two, even 3 years of your registrar years in the area where you want to end up is a good way to get your foot in the door, to get sort of known, and to scope out what's around. Also, I think it's important to try different jobs as well. So, I'm speaking mostly from a pediatric perspective, but if you're thinking private neonates might be the way you go, see if you can link in with a public hospital that maybe has a private attached, or if you can tag along with someone and see what their day-to-day life is like. Because a lot of it you don't know until you do it, and often once you commit to a job, it's really hard to back out as a consultant. It's quite different to registrar work where you're often on short 6-month contracts or 12-month contracts. If you don't like the job, you kind of know you're going to move on soon anyway. It's a bit different once you've got particularly a private patient load to chop and change jobs. So I think you need to, if you can, try before you buy a bit, chat to people, have these conversations, and but also be prepared for life to be completely unpredictable. So for me, I always thought I'd end up at the big tertiary hospital in pediatrics in Melbourne, and did a lot of my training there and in around sort of central Melbourne. And I did my very last rotation in a regional centre because that was the last thing I had to tick off for my training. I absolutely loved it. Got all the jobs I wanted just because I happened to be at the right place at the right time. As I was finishing training, a maternity leave position came up. My children were young. My husband was a stay-at-home dad, so it just sort of worked for us. Never in a million years would I have thought that was going to be where I ended up. So I think also have a think about what you want, but also be open to other options as well. and just be willing to explore, and you might be surprised where you end up. And I think that's the beauty of consultant life. You can do little fractions in different places, try out different things, and then eventually you kind of carve out your niche. And I'm very, very lucky as a second year consultant to be doing literally every single area of interest of mine in pediatrics. It's incredible. And that was just because I took a chance.
Yeah, exactly. It's a great point, isn't it? As a registrar, that is the time to give things a go. Try regional, try different places, try the beach, the outback, whatever. And because, as you say, once you lock in on a consultant job, you might be there for a while. So what a great opportunity to just try a few different things, and I guess keep the attitude of being open to being surprised. I love that way of approaching life. Is I may have a goal, I may have a path I think I'm on, but I'm also open to, if I see a better path, I'm happy to take that too.
Yeah, and I think that's really important because I have a lot of colleagues who are very sort of, set in where they plan, where they envisage they would be and the sort of hospitals they would work at. And if that doesn't happen because, it's competitive, you just end up being miserable. So I think at times you just need to be a bit open to trying different things as well and giving things a go. And it's not easy. It's hard with kids. It's hard with partners who are working in different jobs. So it's challenging, but I think it's just something that the reality is jobs aren't easy to get. We do have job security, but the jobs that you want may not be easy to get. So I think it's just being open to that as well.
Averages, we're short of doctors. But when you get to specifics, you may want a specific role in a specific place, and there may be one, so averages don't help getting the specifics necessary.
And look, that's not to say you can't work towards your ultimate where you want to end up. So you might, a lot of people who start consultant life do small fractions at different places, figure out what they like, see out a contract, and then move on. So it's definitely possible. I guess it's just keeping an open mind about it.
You've prepared, you've thought about the life stuff, you've talked about the job stuff. Let's talk about being a consultant, the good, the bad, and the ugly.
Sure. Okay. So the good stuff, which I'm sure most of us have seen as you go through your career and you work with consultants that you might look up to, there is a lot more flexibility. So, for example, I'm currently working now. I'm on for the ward for I cover hospital in the home. I'm available on the phone, but I can duck out and do a school drop off or a school visit. Now, of course, it depends where you work, but again, regional life. Just giving a plug to regional. Um, but so you do have much more control over your life to the point where I actually found it quite challenging when I first started, when they said, tell us when you want leave for the next 12 months. And I thought, oh my goodness, for 13 years, someone has told me when I have to take my leave, what time of the year and how many weeks of leave. And now I can literally just pick whenever I want. So there is a lot of flexibility, which some people find a bit difficult because you suddenly lose that structure that you have in training, which is why it can be part of the bad and the ugly. But in general, most people really enjoy the flexibility, particularly once you've got children. Financially, so you often would make quite a lot more for less hours just by the nature of the way the EBA and paid per hour works. You get CME. I don't know if that's something that you see nationally and across New Zealand, but continuing medical education. So you get paid a certain amount by the hospital for your conferences and for anything that contributes to your medical education, which is really helpful because that means that you can sort of risk-free make sure that you're continuously learning and growing, which I think is a great initiative. You've got a lot more autonomy, and although a lot of these things, mind you, fall in good, bad, and ugly, so having autonomy with it comes other issues, which I'll talk about. But for most people, by the time you've got through your training program, it is really nice to have that autonomy and that sort of ownership of your patients, which can be really lovely, and you can build up relationships with patients, particularly in private land where you're seeing the same patients over and over. And there's just so many opportunities for leadership. There definitely is opportunities for leadership as a registrar and a fellow, but once you're a consultant, every day you're on the ward or every time you're in with the team, you have the opportunity to be a leader. And then there's opportunities to work on that as well. So as a second year consultant now, I'm stepping into the director of pediatrics role, and I'm a second year consultant. It's just amazing. So there are opportunities if you are so inclined. There are opportunities to build on your areas of passion, and you can kind of carve your path a bit. So, I'm a pediatrician with an interest in allergy, and I now do like specifically allergy on the side, which is you could never do that as a registrar, really. So, unless you're in a formal training program. So, I think it's that flexibility, that being able to carve out your path, and having a little bit more control over your life is definitely part of the good.
It all sounds like roses, doesn't it? It sounds brilliant. And as you say, there is a lot of good. But it comes with some challenges too, doesn't it?
Absolutely. And look, each of these things can be flipped to something bad, something ugly. So, flexibility, while it's great, you've got complete ownership of your private patients, which, depending on your specialty, how often they contact you, how they contact you. So a lot of people find that quite challenging, and keeping up those boundaries can be really hard, but it's really important. And you'll have some specialties who give out their mobile number to patients, but then are contactable 24/7. Some specialties are only contactable when they're in the rooms, and only on those specific days. And I try really hard to stick to that boundary, because otherwise there's just a lot of scope creep, and creep into the rest of your life.
I imagine it's something you have to stay quite strict on because it'd be one of those things that the moment you waver, open the door up ajar, and the patients will come flooding through.
Absolutely, absolutely. And I've just found, particularly with my social media following, although I practice under a different name, I still get families contacting me on Instagram, sending me photos. I've seen you in clinic today. Here's an updated video. And so I've got my lines that I use, and I'm getting much better at keeping that boundary. But that's with flexibility and autonomy comes that side of it as well. Um, with the finances, look, it's again, we are definitely very lucky in what we do. We do get financially remunerated very reasonably, but there is a lot of unpaid admin time, and sometimes, I think after a clinic, if I calculate the amount of admin time post the clinic and writing to emails and contacting families and schools and whatnot per hour, it doesn't really feel like that much. Um, so, I guess it depends how you think about the finances. It can be challenging, and it's a lot. I don't know if anyone's had a small business before, but my husband had a small business previously, and I could see how much work it was. It's like that when you work in private. You have to manage your BAS statements every 3 months, your taxes. So it's a lot of a mental load, which is very different to working through public hospitals for your whole training. Um, the autonomy, I probably struggle with the most. So while I enjoy the autonomy, particularly say when I see the neonates in the private hospital, I really like being able to see them, and I'm their ped, and it's really lovely. But then also it can be a little bit nerve-wracking, particularly if you struggle from a bit of imposter syndrome, and am I doing the right thing? Who can I bounce things off? And it's not uncommon that I'd finish a shift and think, gosh, did I do the right thing? I don't even know. And I'm getting much better at that because I just know that I just ask for help. I think we'll talk about that towards the end. But that autonomy can also bring with it other fears. It can unmask other sort of insecurities as well in yourself as a person because, you go through all your training having someone to ask, someone to bounce ideas off, and then suddenly you're that person. Um, so I really struggled with that with my own self-confidence at the start, and it took me quite a while to get to a position where I felt like I know some of the answers and many of them I don't, and we just ask people. Um, a little tip that we have, I'm very lucky in that I work with a really gorgeous group of consultants, and every time there's a new consultant, so over the last 3 years, all the new consultants have made a little group, and so we just call it our baby consultant group. And every time we've got what we think would be a silly question or something really straightforward, or hey guys, would you start topical or oral on this? We just pop it to our group, and usually between us we can come up with a sensible answer. And I found that really, really lovely. So that would be another huge tip. If you're starting in a workplace, see if you can find your people that you can ask questions from. Not that I think you should be able to ask questions from anyone, but the reality is there is a little bit of a hierarchy. There's a bit of experience, age that comes into it. And so I think finding people in a similar cohort to you, we're all young mums, we've all got young kids, and so we understand the complexity of being a consultant and having a family, and it's just nice to have people to bounce things off. Sorry, I'm diverging from the bad and the ugly.
You're good. I think it's great. I think it's great because um, you know, going in with eyes open. I think that's the key. It's not all roses, but it's also not all tough. It's like life. It's like anything, isn't it? It's got it all.
The last thing I did want to point out for the bad and the ugly is the administrative tasks. I think, when you're a registrar, you're putting in timesheets, you get to put in X hours if you've had to stay back on clinic. There's a lot of unpaid administration that is just expected as a consultant. You're expected to have a portfolio, you're expected to sort out these patients in your own time. So I think it's just being aware that there is a lot of administration, and with the leadership opportunities comes some challenging discussions as well. So, challenging feedback discussions, or there's been a really significant outcome on the ward, you just need to sort it out. So I think it's also just building your own resilience and leadership skills in that way. And you don't have to be in a leadership role to be doing those things. As soon as you've got nursing staff, junior medical staff working around you, you need to be able to do those things, deliver feedback, be constructive, look for systems improvements. So um, I think even if you're not leadership inclined, that's a really important part of being a consultant, whether you like it or not.
I agree. That's what I started with. Is we are all to an extent managers or leaders once we become consultants. I say we. I am not. But as a group, that it is what it is, and so we may as well get good at those core skills of getting the best out of people, helping people to grow, making sure that we're doing the best we can to deliver the best possible care to the patient in a manner that the patient can appreciate, I guess. So let's talk about public and private, because that's a big area that a lot of doctors talk to me about and go, look, I've just got no idea because I've never worked in the private system. Not no idea, but there's a lot I don't know. So yeah, so what are the benefits? What are the differences? And we've talked about some of the things, but how do doctors prepare to enter this new world of private practice?
When I start off by saying with public work, often you're salaried, you get your pay slips, you pay your tax before the money lands in your account. You've got sick leave, annual leave, personal leave, long service leave. You've got all these entitlements in a public system, and your continuing medical education and things like that. So that's kind of the perks of your public system. One thing I did forget to mention is just when you're prepping for consultant life, don't forget that if you work public, you've got long service leave entitlements. So after you've worked X many years, you get long service leave. A lot of people want to take a break between doing their training and starting consultant life, which is fantastic. I'm all for that. But just be aware that when you do take a break, you do void your long service leave. That's just something that no one really tells you about. So sorry, I digress.
Is there a way to get around that? Is there a way to kind of push pause so you don't lose your long service?
Not unless you're on maternity leave. And even still, you need to have a contract at a public hospital somewhere. So even if it's, one shift a month or whatever, you just need to have a public contract, which is challenging. It's not doable for everyone, but something to just be aware of. Um, so that's the public system. So you've got all those entitlements, you get beautiful pay slips, you pay your tax. In private, it's very different. You are running as a sole trader, essentially, in a business. So you are often getting paid and then you have to pay your tax back. So a lot of the money that sits in your account isn't your money at the end of the day. So if you work in a clinic, we get all of our money from the patients via the clinic, and then at the end of each month I have to pay an invoice. And depending on the clinic, it can vary. You essentially pay a percentage back to the clinic. Some clinics you pay rent for the room and the staff. Some clinics you pay a percentage of your earnings as a service fee, and that can be anywhere up to 40 to 45%. depending on where you work, or you can pay, X $100 per day to have the room. And then if you see one patient or five patients or 20 patients, you pay that amount. So speak to clinics about how their setup is, because that can actually really impact your income, particularly depending on how many patients you see. I mean, if you're someone who sees a patient every 15 minutes, it might not be as big a deal, but I spend an hour with my new patients, so it's not in my best interest to only see two or three patients.
So ask those questions, really, figure out what is the model that's applied here, and is this the best model for me, I guess.
Absolutely. And so, different clinics will run differently, and this information is not available on the website. You have to speak to someone who in an admin role, but ideally someone who works there as well. Because I think the other thing when you're considering a clinic is, what is the morale like? What is the administrative support? So, you can work in a clinic that's really beautiful and fancy, but you can't for the life of you get a letter sent out to a patient. Or, or they might flick you every single email that comes from a family, whereas our clinic are very good at saying, sorry, Dr. Nelu is not in today, you'll have to she'll get back to you on Wednesday. So you just need to think about that sort of support as well, which you don't have to think about in a public setting, because you just do whatever is there. But you've got a bit of choice now. So I think about that. And the other big thing is, when I first started, I did join a clinic where I was a sole practitioner. I was a sole pediatrician in the clinic, and it's really different to where I work now, which is a whole group of pediatricians. You don't have people to bounce ideas off as much. You don't have that collegiality. So I think it's just being what's important to you. Some people love being, flying solo and just doing their thing. I personally love some peer review. I love chatting to other staff members in the coffee room, and it's all people I work with at the hospital, so it's just gorgeous. But just have a think about your vibe and what you need to thrive, um, and ask those questions, because you will not know. The worst thing you could do is just start in a clinic without asking questions and then realize that you're locked into this setup and this place that you don't enjoy and you don't thrive in.
A lot of the value of a conversation like this is, if we're going into new areas, we don't know what we don't know, so we often don't know the questions we should be asking. So to me, this is really useful, because the questions to be asking are, what's the business model? How am I going to be paying for this? What's the collegial support looking like? And just get really clear on that. What's what are the rooms like? But also, what's that administrative support like? And talk to some doctors there and things, because those are the sort of things that I imagine you could kind of gloss over at the start or not even ask about, but they really become the thorn in your side if they're not serving you.
I made that mistake. I started in a clinic that I really enjoyed the idea of. This was when I was the sole pediatrician, and I realized, as my very first consultant private job, it was just chalk and cheese to where I'm currently working now, in that, yeah, I felt like I was flying solo. The administrative support wasn't there. And, the patient cohort is quite different in private land as opposed to public land. And
expectations are probably quite high.
Very high. And where that initial clinic was based, yes, it was a beautiful room with the day spa and everything, but the patient cohort was very different. And I just wasn't used to that. After 13 years of public peds in, doing quite a lot of work in low socioeconomic areas, I found it quite challenging. Um, and so I think it's all those things that you just would never even think about, that I think it's worth giving consideration to before you commit to somewhere.
That's the beauty of this. It's not about giving the answers, it's about having the right questions so people can find, what's going to work for them. I think, to me, it's a really good, we could talk about public-private for a long time, but it's a really good way for people to think about it, to structure how they get into private, into a supportive role that they enjoy, that is professionally fulfilling.
Absolutely. And you do you. I mean, some people might love to work in a fancy building in the city and see just lawyers and doctors. Totally fine. But you just need to think about what works for you.
That's right. Look, the lawyers and doctors, kids get sick too. Yeah, well, it's probably the wrong audience to be bagging doctors. But anyway, moving it along. Let's talk about. We love you guys. We love you all. So we're just joking. Let's talk about mine. What was that?
Who are you?
Oh, exactly. We're the best. We're the greatest. So there we go. I think we'll leave it at that. And mindset and identity of being a consultant. Like we discussed there's a bit to think about, but we discussed two key areas that doctors need to actively, consciously shift in their identity to be a good specialist. And the first one is shifting from the mindset of, I'm a registrar to, okay, I'm no longer a registrar. So what does that look like?
I really struggled with that. So I'm glad you've asked me that. I particularly probably because I stayed on as a consultant in the same place I was a registrar. So I found that shift externally challenging because the nursing staff, the admin staff, everyone sort of knew me as a reg. And it took a good 6 months for some staff to stop referring to me as a registrar, which didn't bother me, but I think that made that transition just ever so slightly more challenging. And then for me personally, some of the regs continued in a reg role while I then stepped up to a consultant role. And I found that really challenging because, 2 months ago, I'd be staying and doing the hard and grind with you, going through all these admissions. And now I'm saying, see you guys, I'll leave you to the admissions, call me if you need me. Um, I found that really challenging. And I think also that's my personality. I prefer to just stay and help and get my hands dirty and do the admissions. But I think it's part of realizing that when you become a consultant, part of your role is to be able to let go a bit and to have that sort of, that staying on the top of the dance floor mezzanine, looking down, making sure things are functioning and working, putting out fires, but not being on the dance floor doing the nitty gritty. Um, and I found that that's probably one of the hardest parts I found with transitioning to a consultant. And in my early chats with my consultant mentor, we were allocated a consultant mentor for all the new consultants where I work. Again, really important things to look at when you're deciding on a place of work. And my biggest feedback at the start was you need to let go a bit. You need to stop being a registrar, and you can't be there from 8 to 8 on a weekend supporting the team get jobs done. Your role is to be some oversight and then to hand on the work and make sure that they've got you as support, but you don't need to be there doing the work. Important for your own mental health, because we do sort of 72 hours straight, and for your own physical health, but also important for that level of respect, which took me a while to really come around to. I found that challenging because to me that equated to I'm better than them or I don't need to do the hard work.
What beliefs did you need to shift to make that transition? Like what was it in you that was making it difficult?
I think I'm just so used to being a registrar. The truth is, I trained for 13 years to get through my training program with time off for babies and whatnot. But I was just so used to just doing the work. Um, and I kind of, because I started so long ago, I was in that generation where we'd do 12-hour shifts every day for weeks and weeks on end. And you just got used to the grind. And so I found it really challenging to suddenly take a step back and just what feels like you're fleeting in and out, but providing that level of support. And I'm 2 years in, and I have to say, I'm only just starting to feel comfortable with that. So it takes time.
Yeah, okay. So that's probably another point is that it's like be kind to yourself knowing that this is a transition. This is not it's not going to feel like for some people it might, but for a lot of people it's not going to feel like a switch that you can just turn on or off.
No, and look, you meet people who do that, and I have to say there are people that I went through training with who the day they became a consultant, there was a switch and a shift, which didn't quite gel with me because that's just not my style. But some people can do that, and well done to you if you can. But the reality is most of us can't, um, and it's okay. It's okay, and I think it's important to have people pull you up on that as well. I had my mentor say, you don't need to be in this many days. You don't need to spend an hour with each postnatal ward patient answering every single question because you feel like you just have to, because you're working so hard leading up to that point. I felt like I just had to keep working that hard. And the point is, you're here now, you've done the hard work, now you get to take a step back.
Whenever I've looked in my life for changing something that needs to change, there's a couple of ways you can approach it. One is change beliefs, which change your behaviors. But sometimes the other is actually just change the behaviors and keep consistently doing that, and the beliefs change as a result. You can approach it from two different ways. So I guess you're describing a mixture of both, which is start to see yourself differently, but also start to consciously make decisions about, not staying for the discharges and understand that that's going to be uncomfortable at the start. And you're going to, you're going to feel a bit torn, but do it anyway. And over time, you develop a new norm.
And I think what you're saying about changing behaviours, so some really good feedback I got was, so I would stay and do all the ward rounds and then go to the private hospital. So I was given the advice to see the sick patients, then go to the private hospital. The team can manage what they can, and then you go back and help finish the round. And actually, it functions just fine without me there. And so once I've started doing that on a few weekends, I've realised, oh, actually, I'm okay to not be here all the time. But so I did have to change those behaviours first to then start to realize that I could change my beliefs.
As a junior doctor, those are the sort of things you actually love. It's like they trust me enough, to handle the not so sick kids. But whatever, I'm still going to take it because you get to sort of feel like you're in charge. And yes, they'll run it by you, but that's how you bring on the next generation to be independent doctors.
Absolutely. That's the only way you learn to make decisions, is if you get to make decisions.
Good point. So that's the first bit. It's that shift from I'm not a reg, a conscious shift, to I'm a consultant, I'm a specialist. The second part we talked about was a very common trap that people fall into. Tell me about that.
So I also really struggled with this, which was the notion of I need to know all the answers. The buck stops with me now. I just need to know. And I actually consciously felt in myself as I was approaching the end of my registrar time, I actually became more anxious about making decisions because I was just thinking, in 2 months, that's going to be me. I have to make this final decision. And I actually found it really hard to make any decision. And I thought it was just me, but I've spoken to a lot of people who have been transitioning and they all feel the same. I literally just had a chat with a fellow who's going to stay on and do a little bit of locum consultant work. And she was saying the same thing. She's like, I was at a resus and I just froze because I know I'm going to be a consultant soon. And what if I don't know the answer? And we see that. It's a problem. It's a huge problem. It's also a bit of a rite of passage. And I think it's kind of nice if Donning-Kruger, if you kind of are aware of your limitations. Um, but I think it's important to realize that, and again, it's taken me time to realize this, that you don't need to know the answers. And I used to really struggle in handovers when there would be a curly situation or, some sort of clinical conundrum. And I would just think, God, everyone's looking at me to give them the answer. And when they ask me a question, I need to just know it because I'm the consultant. But really, you don't. You don't need to know every answer. And I'm becoming so much better at saying, you know what, guys, I actually have no idea. Why don't we ask someone? Or, sometimes if the reg has done an endocrinology job and they know something that I don't, I'd be like, can you please just fill us in, let us know, and just working with your team and their strengths, but also being absolutely okay with asking people for advice. I'd say, hey, I'm just going to chat to the other consultant who's in the office to see what their thoughts are, or let me call the retrieval team and see if they think I need to do anything about this blood gas, and just being okay with asking for help. And again, it sounds really trivial, but once you step up to a consultant, there's just this innate need for you to feel like you have to have all the answers, but you absolutely do not.
It's that accountability and the mistaken belief that accountability means I've got all the answers, as opposed to accountability means actually my job is to get to the answers. And I may have them, you may have them in my team, or we may find them. But, that's a better sort of mentality than it is all on me to be, perfect. Because as we know, there's a lot more in medicine that we don't know than we do know, no matter how good we are.
And I think it becomes self-destructive. And like I really, really struggled my first few sort of ward service weeks with the notion that, oh, I don't know the answer to this. Everyone's going to think I'm stupid. They're going to think I'm not a great consultant. And do I even deserve to be here? Just all that whole mental load that goes with transitioning to such a big role. And now I'm just so much better at saying, oh, I've got no idea. Let's just ask someone.
It probably allows you to just get to much better answers. Well, not probably, definitely allows you to be a better doctor. So let's talk about leadership as well. We are really covering the big stuff, and we're doing it quite rapidly. But let's talk about leadership. This is the area. This is that whole sort of we're all going to end up in a leadership position as a doctor. And there's a lot we could talk about there, but you talk about two really important areas, and I think they're worth they're worth having a discussion around. You talk about setting the tone, and you talk about nurturing the next generation of doctors. So let's talk about setting the tone first. What does that look like? What does that mean to you? And I guess, and why is it so important, as a specialist, as the consultant?
I was really lucky in that in my training I did a year of the Chief Resident Medical Officer, which was basically a link between the junior medical staff and the wider hospital. And what it taught me was that when you're a junior medical staff member, you often complain a lot, which is completely fine, right? You find the flaws, that don't like this doesn't work, but we never really go that next step of saying what can we do to fix it. And it wasn't until I was removed from that in that non-clinical role that I realized a lot of issues come to me, but no one has really gone that next step. And I think when you become a consultant, I think that is the shift that you need to see in yourself. People will come to you with a problem, and sure, there's a problem, but what can we actually do to fix this problem? And thinking about that systems change. And for me, that's a big part of what leadership is. And setting the scene of, sure, we can complain about ED giving us a bad referral, but that's not the tone we want in this room. The tone is, you know, what can we do to support ED? Why don't we just give, when we're taking the referral, let's just give them a bit of education so that next time they know what to do. Or just kind of, it's just a really minute shift of, you know, of sort of bringing up issues to what can we do to improve things.
Elevating the conversation. Something I've found really important in business is, don't treat the symptoms, treat the cause. And junior staff are always going to focus on the symptoms. Whether that's we're getting bad referrals, or in our business it's going to be completely different. But you've got to, I think, as a leader, your job is to think more critically and think more deep. Think of second order consequences. Take it up a notch and go, yes, we could throw solutions at the symptoms, but let's fix the cause so that the symptoms aren't happening.
I think also just that in that setting the tone piece, just thinking about the way we speak to people, the way we speak about people, the way we speak about families, a lot of that comes from the consultant. So as soon as you've got a negative or a derogatory consultant, that just changes the whole tone of the room, of the junior medical staff, of the nursing staff. So if you can be that person who is always kind and compassionate, but also gets things done, then that sort of sets the tone. One of my favorite activities that I stole from my chief resident year was a bubble of joy. And anyone who's worked with me knows that I'm obsessed with this, but only because it works every time. So basically at the start of a ward round or start of a handover, everyone would just go around and say something that has brought them joy. It sounds really airy-fairy and really wanky, and every time you do it the first time, everyone's just rolling their eyes. But by the time the last person does it, the mood in the room is so different. Everyone has just had a little glimpse into everyone's personal life in a really nice way. The mood has dissipated, and you just start your day or your round or your meeting in a completely different way. And it really just shifts the mood. So just little things like that. I've had on at the end of a ward round, get someone to give some nice feedback to the person who did the examination or the presentation, or just trying to put little pockets of joy into your day, because that actually really reflects in the team. And again, if your team's happy, your patients are well looked after. So that's setting the tone.
I think it's so important. Sorry, interrupting. Carry on.
No, no, no. I was saying just to set the tone in both a constructive way with managing issues, but also in a positive way as well.
I mean, the reality in medicine is, yes, every doctor can be a good influence, but the reality in medicine is hierarchical, and the consultant has a much bigger influence on a team and the morale and everything. We all know this. So once you're in that consultant role, there's the opportunity to have a compounding effect on a lot of people, and therefore their patients.
Yeah, I mean, even if you look at hand hygiene data, if the consultant practices safe hand hygiene, the rest of the team does it. If a consultant does it, why would the medical student do safe hand hygiene? So you have a lot of impact, and you have to use it for good. Yeah.
A lot of ripple effects when you're a consultant. I think that's a great, and if you just approach it with that in mind, you'll make better decisions. You'll set a better tone. you'll ask better questions, you'll be more supportive, you'll follow the things like hand washing because I remember this is very sort of a side thing, and I remember there was a period in my life, and I wasn't exercising very frequently, and I was like, I had a vision, I had all this sort of stuff as to why it was important, and the thing that changed everything for me was added and be a role model for my kids. So when we think about being a consultant, if we add in and be a role model for the rest of the people in my team, because they're going to take their cues from me, we often find another level and get the best out of ourselves, I believe.
Absolutely. And I think that's the way to support the team. So, I don't support the team by being the brightest person in the room or by making the best clinical decisions, but I try to support my team in that way. They know that I'm going to be there if they need them, but also that we foster positivity and support and kindness, which again sounds really lame, but it's really, really important.
Now, this episode was delayed a little bit, and I'm bringing it up because this is the reality of being a doctor. You've just come off a pediatric mortality last night, which I'm obviously sorry about. Um, you know, as the leader in your team, where is there, I guess, what is your role in that so that from an awful situation, you can help your team through it.
Thank you for acknowledging that. I wasn't personally involved, but for me, in my current leadership role, it sort of becomes part of my role is to support the team. And so for me, it's the logistics of, how do we now deal with all the legalities and everything else, which there are the right people in the hospital to do that. But it's how do we make sure the HMO who happened to be staying back late on their shift who was present, who is now going to go off to another rotation and take this with them. How do we support the registrar? How do we make sure that the people in ED who were around at the time are being supported? So I think it's just thinking, for me, it's more about the junior medical staff and thinking about making sure no one is left behind with this, um, and offering sort of support early on and then also following up as well and debriefs and whatnot and coordinating that. So again, as part of my leadership role, that's something that I'll need to do. Unfortunately, we've had another one that we've had to deal with, so I've kind of know who to talk to. Um, but yeah, it's that sort of, and in a way, it's easier for me because I wasn't actually involved, so I don't personally need the debrief. So I'm in a good position to be able to coordinate that. But it's thinking about every last person, and you often hear about significant recesses where the PSA who's bringing the blood doesn't get the debrief, but they have seen all of the nasty. So I think it's just trying to think about that wider picture. And then, I've lost a baby earlier on in my career, and so I guess as a mum who has previously had my own neonatal mortality, just being aware of the family and the long-term effects of something like that as well. But again, once you're a consultant and you've got that life experience behind you as well, you can bring that into your work, which I think is really special. Um, and that's part of the ugly side of leadership. You just have to be the person that makes those calls and has to. Well, it's not that ugly actually. It's actually quite nice to be able to support people through that.
It's a privileged part, it's not the easy part, isn't it?
Yeah, it's not the easy part. Yeah.
Yeah, and I guess that being setting that human tone, because we know in medicine that our risk is that we become too clinical, too removed, and we do it to protect ourselves. And but looking after the next generation of doctors, we've got an opportunity to be more human than we have been. And that's a better thing. It's a better thing because we know that doctors are burning out. We know doctors are leaving healthcare, and there's a myriad reasons of why that's happening. But one of them is just it's a very, very hard job, and I guess as a leader, you get to set a tone of how to you support people through that hard job.
Yeah, and when you were saying about nurturing the next generation, I remember in my first weekend shift as a cardiology resident in pediatrics, 12, 13 years ago, we had a patient die, and I literally had to just see the next patient on the ward round, and that was it. There was no discussion, there was no debrief. I was in a stairwell crying in between ward rounds, like, and that just wouldn't happen now. And I think that's really fantastic that we've made that shift in the last 10 years. But again, that has to come from higher up. You can't be the consultant that turns a blind eye. And part of that is also role modeling. So, for example, when I first started as a consultant, if my kids were sick, I'd still be at work, or if I was feeling rubbish, I'd be at work. And my head of department would say, how are the junior medical staff ever going to learn if you push yourself? And so I've become much better at looking after myself, not only for myself, but also to role model how important it is for self-care and for your family. Like, I will be late to handover by 5 minutes so I can drop my daughter at school. That's what I have prioritized at the moment. And setting that tone, I think, is really refreshing for the junior medical staff. And that's part of nurturing that next generation.
It comes back to being a role model. So let's talk more about that because that's the second thing about leadership is nurturing that next generation. What are some of those principles that you apply to do that?
Yes, I think it's pretty much what I was saying. So just practicing what you preach, really. Like I'm really good. Yeah, I'm really good at making sure people look after themselves, rearranging rosters so that if someone's going through a hard time, they've got time off. But then, for example, 2 weeks ago, I fell and I broke my coccyx. Um, and then I was at work all week. And by the end of the weekend, I was in so much pain. And my 4-year-old said to me, Mum, you just need to go to the hospital and be a patient and stop being a doctor. And I was like, gosh, even my 4-year-old knows that I am not practicing what I preach. And so I took a few days off and stayed at home. But, and I still need those reminders. But I think it's part of that nurturing the next generation is nurturing ourselves because that's what they learn from, right? We learnt from the generation where you just got up and got on with things. And even if your family's falling apart, or, I went to work with ulcerative colitis, running to the toilet 20 times a day as an intern, and then ended up in hospital with pancolitis. Like, that's the generation I grew up in. But, but that's not going to make you.
And you would have been respected for it.
Oh, absolutely. I was that intern that went to work even though my bowels were bleeding. But, that's just not a way to be, and that's not a way to foster. It's just, yeah, it's bad for so many reasons, and it sounds really obvious saying it out aloud, but that has to come from higher up. You can't be the consultant that pushes yourself and then expects everyone else to not push themselves.
And the other area around that sort of nurturing the next generation is their skills as a doctor. Their clinical skills. How do you let people learn and make decisions while at the same time making sure that they're making good decisions?
So I think part of that is being able to step back. And you don't know what they don't know until you give them a chance. And, the majority of times people are safe. There are lots of different ways to do things. And I think part of it is also understanding there are different ways to do things. So, if you ask 5 pediatricians, they'll give you 10 different ways to manage a child who's not gaining weight, for example. And so I guess it's just being okay with the fact that as long as it's safe, they don't have to do exactly what you would do. Um, and I found that when I was a registrar about to transition to consultant, my feedback was you don't need to ask us so many questions. Just do what you're doing and then just tell us because your decisions are always safe. It might not be what we would do, but your decision's safe. And so I think it's kind of that letting go piece of just letting go with your way is the right way. And also just you might be surprised, you might learn something from how the registrars manage something. They've come from different hospitals, they've had different training. So I guess just being open-minded, but also giving them an opportunity. And look, sometimes things are going to not go exactly to plan, and that's okay as long as you can evaluate those systems. Um, but the only way really I think that they can grow is to have that opportunity, but to also know that they've got your support. At the start of every on-call shift I do, I tell the reg, I live 15 minutes away. Call me anytime for absolutely anything. I'd rather you call me than not. I'm also equally happy for you to make decisions that you feel are safe. And I think that just empowers them to make decisions. And then in the morning, if where I'm in handover and I may not disagree, I may not agree with something or the outcome wasn't fantastic, we just chat about it. And people make mistakes. We very rarely make a mistake that leads to a terrible outcome, particularly in pediatrics. Everyone's a bit more conservative than not. And so I think it's that, again, part of that letting go, understanding there are different ways to do things, and giving junior staff an opportunity to grow. Because if you don't, then they just, like I said, if they don't get to make decisions, they'll never learn how to make a decision or make a mistake.
And how do you do that while still making sure the guide rails are there so that they feel supported and also the patients are getting good care? That's your helicopter view of things.
I think part of it is having trust in the system as well. Like we've got a fantastic unit with great nursing staff who are very experienced. So we generally have a few layers of catching those outcomes. And with things like Victor charts and parent outreach calls and things like that, I feel like there are safety nets in place. But also it's trusting those safety nets, and they won't always. There is always a Swiss cheese and things that slip through the cracks. But you kind of need that to happen sometimes to realize where the cracks are. And it's just being comfortable with that.
Sure, and that's all the age-old difficulty with medicine is, it's people that, it's happening to, but that is part of the reality of the job, isn't it?
And as long as it's not a terrible outcome, it is the way that systems are improved. That's why we have VIMs or wristbands and things so that you can actually put in systems processes to make sure that these things don't happen. But I think part of it is just accepting a level of insecurity with it.
This has been an amazing conversation. We've covered a lot, and from the things to think about to prepare, that the specifics, the very technical things that actually need to be done, like get an accountant and things, how you get a job, the good, the bad, and the ugly, the public private balance and transition, the mindset areas around being a leader, and the leadership skills that are required. There is a lot to it, and I think just the wide ranging nature of this conversation highlights to me that what a challenge this is, but also what an opportunity it is for people to step in and to be a positive influence, to have that compounding ripple effect where they positively impact the people they work with and ultimately the patients. So I've enjoyed the wide ranging conversation. But I'll leave it to you. Despite the fact that we identified what difficult parents doctors are, we're just kidding. To leave people with any final thoughts, in terms of this transition that almost all of us make as doctors to leadership, to being a specialist, and what would you like to leave people with?
I guess it'll be just to be kind to yourself and be kind to everyone around you, which sounds really simple, but it's really important. You need to look after yourself and your family. That is the first thing. You're always replaceable at work. So you need to make sure that you look after yourself. And then you need to look after your team. Because, like I said, it's a famous Richard Branson quote where if you look after your employees will look after the clients. It's the exact same thing in medicine. You need to look after your team, and that starts with you.
100%. I mean, it's like in business when you sort of go from being the one person to actually the good happens through other people, and it's sort of a step back and getting pride from other people's success, and growth and fulfillment. It's a privilege.
Be kind to yourself. Like everyone goes through this, and it's no matter what you're thinking, someone has been through this when they're transitioning. So just talk to people and don't expect too much of yourself as well. It's a period of growth. You don't suddenly click your fingers and be the world's best consultant.
I think it's a great sentiment to leave with. Is for anyone going into it, it's like, okay, this is going to be a process. And knowing it's going to be a process, knowing everyone else is going through a process too, and being kind to yourself during it will make it a whole lot more enjoyable.
Well, thank you so much for having me.
Well, thank you. This has been a fantastic conversation. Thanks to you listeners. I'm sure you've got huge amounts out of it. Nelu, thank you so much. I've appreciated your insights.